All right, good evening. Thanks for making it out. My name is Srikant Kondapaneni. I work here up at the Englewood Health. I work at the hospital, and I also work at in Bergenfield. I'm both a pulmonary doctor and a sleep medicine doctor. Believe it or not, sleep medicine is actually a field, where you get extra training for, you get board, you take board exams, you get board certified and whatnot. And sleep, it's a varied field. A lot of things can affect sleep, which we'll talk about, okay? So first thing is, let's talk about the simplest stuff. What is sleep? What happens during sleep, right? And why do we need sleep? And then what causes sleep problems? That's what we'll talk about. That's going to be the gist of the talk. And then if you guys have any questions, feel free to just interject and ask questions, okay? Because it is more about discussion rather than me just lecturing, okay? You can get lectures on YouTube, okay? All right. So what is sleep? Basically, we know what sleep is, right? It's a state of reduced activity, both for your muscles and your brain. Okay, so you can recover. It's a decreased responsiveness. So obviously, some people could be light sleeper, some people could be deep sleepers, right? So we'll talk about that, how that's affected. It's altered consciousness, meaning if you wake up, you may not even remember everything if you wake up. But overall, you're resting, right? And that's what sleep does. It gives you rest. And then most people probably know about this, but there's different stages of sleep, and different things happen in different stages. There's stage 1 sleep, which is the lightest sleep. Stage 2, stage 3, which is the deep sleep, and REM sleep. People always talk about REM sleep. I need more REM sleep. I need more REM sleep. But the reality is stage 3 sleep is probably where you get the most rest. Okay? And it cycles through sleep. You can see there's about 4 or 5 cycles of sleep. But when you first fall asleep, you go into this light sleep, then you go into deep sleep, then you go to REM sleep, then you go do the cycle over again. You keep doing these cycles a few times during the night. And this is what normal sleep is, okay? Now, if you're not getting normal sleep, if you're not devoting enough time to sleep or something's disturbing your sleep, then you're not having this. Now, this stage of sleep that we see, this type of sleep that we see here, this is done by brain waves, okay? Looking at what's called EEGs. When we get a sleep study done in the hospital, which we'll talk about, they hook up all the leads on your brain to see what stage of sleep you're in. Now, all you probably have these smartphones and apps, tell you how much deep sleep you're getting, and are you going to REM sleep or not, and is that as accurate as a sleep study? Of course not. And remember, some medication, the way those apps see what stage of sleep you're in is by looking at your heart rate, what's called heart rate variability, okay? So here's the thing. If some of you are on medications like what's called calcium channel blockers or beta blockers or like metoprolol or toprol, that's going to affect your heart rate. So those apps that check your sleep, that monitor you via the heart rate, it's not as accurate. Okay, so take it with a grain of salt if you're on those medications, okay? Now, what happens during sleep, yeah?
What does REM stand for?
REM, sorry. Rapid eye movement. Oh, yeah. So here, oops. So interestingly, during the deep sleep, what we talk about stage 3 sleep, what happens there is that's where you get your muscle recovery. That's where your muscles recover the most, and that's when you have what's called memory consolidation, okay? REM sleep is where you get emotional consolidation, okay? Where your emotions come out and you remember more of the emotions, okay? And also during REM sleep, that's when we dream most, right? So the interesting thing that happens during REM sleep is in order to not act out our dreams, our muscles are not innervated. We have what's called muscle atonia, meaning if someone raises your arm during that time, it'll just come right back, it'll fall. Like your muscles can't move. All your muscles are working are your breathing muscles and your internal muscles, such as your heart and whatnot. So if you notice people who are like acting out their dreams, they're punching, they're running, or anything like that, that means they're acting out their dreams in REM sleep. That means there's something wrong that's going on. And that's something to get assessed for. Well, I know what it is, but it's a disorder. Sometimes we usually talking to sleep is actually, believe it or not, light sleep. You're not going into the deep sleep. And talking in sleep can happen more. Some people it's just natural for them. Other people it happens more in like a stressful situation or you're you're not getting your usual type of sleep, either not quantity of the sleep or quality of sleep, or you had alcohol, something disrupting your regular sleep habits, either emotional or environmental, and something disrupting your sleep, and that's when you can talk more in your sleep. So now, what happens during sleep, and why do we need sleep? There's a lot of things that happen during sleep. Let's talk about the brain, okay? You all have heard of something called the lymphatic system, right? It squeezes stuff out of your legs, it cleans out your system. In the brain, there's something called the glymphatic system, so the G. What that does is drains out the plumbing, drains out the waste products. So what happens during sleep is, in your brain, the glymphatic system opens up and the brain gets flushed with what's called spinal fluid to flush out all the metabolic waste that our brain produces during the daytime, okay? So during the daytime, our brain, we're thinking, we got all these waste products that are being made, and the sleep helps clear it out. So now, what happens if you don't get good sleep or enough sleep? Well, it builds up in your brain, okay? And that can lead to fatigue, brain fog, and if you don't sleep for 2-3 days, you're like, I can't think, your brain fog, you can't remember things. That's because you got a lot of all this metabolic waste in your brain. Now, if you don't get good sleep for years, it's chronic, then that's when you talk about need to increase neurodegenerative diseases such as Parkinson's, dementia, Alzheimer's. That's how this fits in. I mean, obviously those diseases are also genetic related, but how poor sleep can increase the risk of them if you have the genetic predisposition for them. So what are the other things that happens during sleep? So for the muscles, repair and regrowth. So what happens to your blood vessels during sleep is your blood vessels dilate, okay? That delivers more oxygen to your body, more oxygen to your legs. If you're like sore, helps take out the waste products from your muscles, helps healing, okay? There's hormones in our body that are what's called diurnal. It releases more during sleep, okay? What we talk about, the deep sleep. All of you heard of growth hormone, right? Well, that gets released during deep sleep. So if you're not getting enough sleep, especially if you're a kid, you're not getting good sleep, you're not devoting enough time to sleep, you're not getting enough growth hormones. That can affect growth, In adults, if you're not getting enough growth hormone, that can affect your thyroid, it can affect your testosterone even. So we talked about men with on the lower end of testosterone. We talk about their sleep, get more effective sleep, then the testosterone levels can actually increase without needing medications. Now, metabolism. There's hormones called ghrelin and leptin, okay? These are the hormones that cause you to be hungry and for you to, your body tell you that when you're full. If you're not getting adequate sleep, good sleep, the ghrelin levels can actually increase. You're actually more hungry. So actually eat more. Okay, when you get good sleep, those levels can decrease. So your appetite, so you won't have as big of an appetite. So that can help with weight control issues. Heart, cardiovascular. So when you sleep, all our muscles relax, right? Our blood vessels dilate. Our blood pressure actually decreases. Okay. And that's good because it's good for 1/3 of your life for blood pressure to be low. 1/3 of your life, your heart to see lower blood pressure because you're asleep for 8 hours. So that's good for long-term health. So you have what's called nocturnal dipping. The blood pressure declines during sleep, which is a healthy response. If you're not getting good enough sleep, if you're getting poor sleep, you may not have that response, so hence you can get blood pressure issues. So now, sleep problems. There's a lot of sleep problems, but there's two main categories, okay? It's called sleep onset and sleep maintenance, okay? Just like what it's on, sleep onset. It can be you can't fall asleep. Sleep maintenance is you're unable to stay asleep, okay? Two different things. Now, sleep onset problems, what can cause it? Well, obviously the most common, very common is psychological. Your brain is thinking, you're stressed, you have anxiety, your brain's always, your mind is racing. You're thinking about what you need to do today, what you need to do tomorrow, what you're doing today. You can't let your mind relax. It could be medical. It could be something called restless leg syndrome, where you feel that, do you guys know what restless leg syndrome is? Basically, it's like when you're in the evening time, when you're feeling like you're ready to sleep, you get like these creepy, crawly sensations in your legs, okay? And the only way to get them better is to actually get up and move around or massage your legs. And that can disrupt your sleep. And again, that can be diagnosed by easily, by seeing a sleep physician. It could be allergies. If you're not breathing well, if you're congested, postnasal drip, coughing, it's going to affect you. If you have breathing difficulties, if you have COPD, asthma, heart disease, heart failure, that's going to disrupt your sleep. If you're having knee pain, back pain, all these things, that can prevent you from falling asleep. So sleep onset problems could be very many things. It could be medical, psychological, or it could be environmental, meaning, you guys ever hear of something called sleep hygiene? No. Okay, there's something called sleep hygiene. I sure made a slide of that, sorry. But basically, it's having a comfortable environment for sleep, okay? What are some of the things that can give you poor sleep hygiene? Well, if you're on your phone a lot, right? All these things, sleep hygiene, we all know subconsciously, we all know throughout life, like turn the lights off. Don't be watching TV at night when you're sleeping, because that can keep you awake. You're streaming another episode, and pretty soon it's 2 a.m., Sounds familiar? Yeah. Don't do work in the bedroom. Don't do work in bed. Because you do work in bed, you're on your laptop, that's a lot of stress. It's going to lead to stress, anxiety, depression. You want to have the bedroom just for sleep, not for work. Have a quiet room. Don't have pets in the bed that can disrupt you, or falling asleep. Have a 5-month-old in a different room. Mattresses. You want a comfortable mattress. Okay. You want a comfortable pillow. You want the temperature of the room. Usually a cooler room is more beneficial to fall asleep better than a warmer room. And that's because when we're sleeping, when we're ready to go to sleep, our body temperature actually decreases. Our body's shutting down. So if you have a warm room, it can help prevent that. So that's a cooler room, helps to fall asleep, augments your body temperature decline as well. So that's sleep hygiene, okay? Now, sleep maintenance problems, very similar in that it can be psychological as well. Like if you have a lot of stress, anxiety, you're waking up with panic attacks. You have PTSD. So that needs to be addressed, So that's a psychological thing that we need to take care of. Also, work-life balance. People who go to bed at 1 o'clock and then wake up at 6 for work. You're going to be tired a lot, You're not maintaining enough time for sleep. So unfortunately, that's probably one of the most common reasons in America right now, unfortunately. And then medical. So again, we're going to talk about sleep apnea. Sleep apnea can cause you to wake up a lot. Allergies, breathing difficulties, back pain, heart disease, heart failure, asthma. But also waking up a lot to urinate. Okay, you wake up 3 or 4 times to urinate, well, obviously it's going to keep disrupting your sleep. And also your environment. If you have noisy places, apartments on the main road, if you live in Manhattan, it's going to be a problem. So, fatigue. We're all tired a lot, right? And we think about what's it related to. We think about hormones, we talk about blood work. But actually one of the most common reasons for fatigue in America is actually not devoting enough time to sleep, okay? And one of the most common reasons is due to work-life balance, because we all work hard, yes?
What I noticed is the side you sleep on
Mm-hmm.
makes a big difference to me.
Uh-huh.
My right side helps me sleep,
Mm-hmm.
but when I'm sleeping on my left side, something goes wrong.
Mm-hmm.
My heart seems to thump harder.
Mm-hmm.
So I have no choice but to turn it back on
Yeah.
to the right side.
What happens when you sleep on your back?
No good either.
Okay. Okay.
It doesn't seem to work.
Yeah.
And also some other thing, you sleep experts, you seem to be one, recommend making the room dark.
Mm-hmm.
It won't work for me because I'm a little scared of total darkness.
Yeah, that's fine, yeah.
I need some light somewhere.
Yeah. I mean, everyone's different, obviously, and whatever you need. I mean, my wife is working on her computer with the lights on and the TV on, I just go to sleep. So,
It's about,
yeah, so everyone's a little different, yeah. Yes?
I wanted to ask you, can you get the same quality of sleep in the daytime that you get at nighttime?
It dep-
Someone who works nights.
Yeah,
I work nights for 30 years.
yeah, you work nights, yeah.
And I sleep in the daytime. I didn't get good sleep.
You do or do not get good
Do
sleep?
not.
Did not when you slept in the daytime?
Well, you need, the sleep was light.
Mm-hmm.
I couldn't get enough. Even though I tried to block out all the
Yeah.
lights, it was never dark.
Yeah,
And I never seemed to get good.
yeah, so that's not uncommon. We have what's called inherent circadian rhythm, okay? That's when our bodies are inherently ready to fall asleep. And there's hormones, you heard of melatonin, right? That's a hormone that gets released about half hour now as our body's shutting down, as our temperature comes down. That's when the melatonin gets released in order to initiate sleep. Okay? For most people that happens at nighttime. If you're like artificially trying to change to daytime, it's going to be a problem. And we work in nights, sleeping nights, and then during the weekend, sleeping days.
I couldn't change.
Couldn't change, yeah.
Even after I retired, I couldn't change.
Yeah. So we can talk about that. You have a circadian rhythm issue. So we can talk about how to change it back, But for example, most people, when they take melatonin to sleep, if they want to, they take it like 2 or 3 hours before sleep. It's not going to work because your body's producing melatonin. So you have to take the melatonin right when your body's releasing it to help increase that dose, increase that melatonin that your body's already producing. That's different for everyone, depending on your circadian rhythm, when your body's rhythm, okay? There's medical ways to figure that out, but basically non-medical way to figure it out is if left to your own devices, what time would you go to sleep? Is it 2 a.m., but you want to go to sleep at 11? If you go to 2 a.m. and you sleep till 10, then your circadian rhythm is 2 a.m. to 10 p.m. 2 a.m. to 10 a.m. Okay, what you're trying to sleep 11 to 7. So if you're taking melatonin at 11 p.m., it's not going to work because your inherent melatonin is not being released to 2 a.m. So you got to figure out if that's your rhythm, then you have to figure out your rhythm. Then you can slowly shift your rhythm to where you want it to be. Something we talk about. That involves timing of the medications and something called light therapy, because we use what's called light therapy, because we know when we wake up also, the UV light causes some wake-promoting hormones to be released as well. So if you want to wake up really good, you need UV light, not this light, but actually ultraviolet light. Yeah?
How long do you think if you want to
Okay, so first thing is figure out what's your normal circadian rhythm. Like what what time can you naturally fall to sleep? Once you determine that, you want to take about 30 to 60 minutes before that. Okay, if you take it 2-3 hours before that, it's not going to work. So melatonin works differently than these Ambiens and Lunestas, you know, because it's not a sleep aid. It doesn't put you to sleep, but it helps augment your inherent sleep hormone, you know. That's what we'll talk about. We'll talk about that. We're going to get to that, okay? Yeah. Also, fatigue. So yeah, most common reason is poor work-life balance. You're not devoting enough time to sleep. Now, the other two, poor diet and lack of exercise. That's huge. Because remember, eating very large amount of ultra-processed foods, oily foods, you're not eating your vegetables, you're not eating clean food, or lack of exercise. That all affects your sleep and fatigue. The bottom two, the poor diet and lack of exercise, well, you can get help for that here, you know. The top one is behavioral issue. You got to help determine what could be best for you. Now, in terms of staying asleep, there's a lot of things that can be a problem with staying asleep. One of the most common reasons for problems staying asleep is something called sleep apnea. You guys heard of that before? Yeah. Anyone of you have it? No? Okay. Okay. So, well, what is sleep apnea? Sleep apnea means during your sleep, your upper airway, right there where your tongue is, where your tongue is falling back and blocking up the airway. Right? Do you see that on the right hand? So when your tongue falls back and blocks up the airway, what happens then? Well, you get less airflow to your lungs, and your oxygen levels can decline. So what happens if your oxygen levels decline? Your brain senses it. Your brain wakes up a little bit, just wakes up a little bit, enough to stimulate the muscles to open up again. Now, if these events happen throughout the night, what happens then? You don't go into deep sleep. Okay, brain is not staying asleep, so it's not going to deep sleep, number one. Number two, after a while, your brain gets so stimulated, you wake up. Okay, 2, 3, 4 times. So many times, what can happen is if you wake up, you go urinate. So I'm awake, let me go urinate. So it could be due to sleep apnea that you're waking up a lot to urinate, not really a bladder problem. Also, if you're not going to deep sleep, you wake up frequently throughout the night, then you can sleep for 8 hours, but still feel tired when you wake up. So in other words, you're getting the quantity, but not the quality of the sleep you need. All because if you're not breathing well at night, it's going to be a problem, you know? And what are the risk factors for sleep apnea, okay? Well, since the airway is closing up, air going through a smaller opening causes snoring. So if you have a lot of snoring, not saying snoring causes sleep apnea. Not all snoring people have sleep apnea, but it's a risk factor. If you're overweight, because if you're overweight, there's more tissue up here, well, it can collapse easier. Okay, easier to close. If you have more weight, it can collapse easier, so more risk for sleep apnea. If you have what's called a small opening back there, okay, that's where the doctor examines you to see if you have a small opening. So if you have a smaller opening, well, you don't need as much collapse to be a problem. You can be getting older is a risk factor because as you get older, your muscles aren't as firm as they used to be, so they can collapse easier. Your tongue can collapse easier. So these are all the risk factors for having sleep apnea. So now what happens? We talked about what happens when you have sleep apnea, how it can affect your sleep quality, okay? But it can also affect you medically, sleep apnea. Because if you're not breathing well at night, well, what happens when someone chokes you right now? What would happen to your adrenaline level? It would increase, right? Your stress hormone gets increased, your blood pressure increases, right? And remember, what we talked about earlier, when you sleep, your blood pressure is supposed to decline, right? That's what the healthy response is. But if you're having sleep apnea and everything's closing up and your adrenaline level increases, well, your blood pressure can actually increase. Okay, so you may end up needing more and more medications. And if your adrenaline level increases, another thing that happens for adrenaline level is increases your blood sugar. So it can affect your diabetes, okay? And if you're having low oxygen levels because everything's closing up, well, that can affect atrial fibrillation. It can put more stress on the heart, okay? So people may need more and more medications for the atrial fibrillation. So we know now people who have atrial fibrillation, if they're getting these other procedures such as getting shocked or ablations, we test for sleep apnea, because if you don't treat the sleep apnea, you get the procedure, you have a more higher likelihood of going back into atrial fibrillation. And then, now, do you know how to treat sleep apnea? Okay, so remember, it's a physical problem. I mean, everything's closing up, so we've got to keep that airway open. And the most common and most effective way, something called CPAP, okay, stands for continuous positive airway pressure. All this, as you can see, it's a mask hooked up to the machine. All this gives air pressure to keep the airway open, okay? It's not using oxygen, it's not using medication. So it's probably one of the few treatments that we have that probably has no, quote, it's essentially no risk factor. If we talk about medications, risk and benefit, or you can get a liver problem with this medication, get a kidney problem with that medication, this is not going to cause any other problem. Okay, I'm not saying it's comfortable or uncomfortable, but it's like if it's uncomfortable, it's like a bad pair of shoes. Doesn't mean it's not going to harm you, but But just like a bad pair of shoes, you don't stop wearing shoes. What you can do is there's different masks. There's big masks, middle-sized masks, tiny masks. A lot of things we can work around to really make it comfortable. Because don't look at that picture and say, oh, that's it, I'm not for me. But trust me, people, once they breathing better at night, they can feel better. Now, some people still can't use a CPAP. There's something called oral appliance. That's what the dentist makes, okay? It's like a mouth guard, mouthpiece. What that does, it pulls the jaw forward, like here. Pulls the jaw forward like that, okay? To make the opening bigger, to help treat the sleep apnea. Now, this is not as effective as CPAP. CPAP is still the most effective treatment, but this could be, a possibility for some people as well. Now, there's something called Inspire. I don't know if you've seen the ads for this a lot. They've been advertising it a lot recently. What this is it's an implanted device. It's like a pacemaker, and that's a same-day procedure, but it's a very simple procedure. And what that does, it sends electrodes to your muscle right here, right underneath your tongue. And what that does is, when you're sleeping, you'll turn on the device. There's a remote control right there. That guy's holding the green thing, the black and green thing. Turn on, and what it does, it stimulates these muscles to keep the airway open. Okay, so instead of using air pressure to keep the airway open, it's stimulating the muscles. Okay, now this is very effective as well. Not as effective as CPAP, so you have to try to, for insurance purposes and for medical purposes, you want to try the CPAP first. If you can't tolerate it, then maybe go to this. Now, insomnia. Now, what is insomnia? Insomnia is different. Now, we talked about sleep apnea. You can only make a diagnosis of insomnia after you make sure you have no other medical issues going on, meaning you don't have restless leg syndrome, you don't have movement disorder, you don't have sleep apnea. Not that you need a sleep study, but you have no risk factors for sleep apnea. You're not on back pain. You have good sleep hygiene. So you're not depressed. Okay. Remember, depression, anxiety are problems. If you treat all that, you got all that controlled, or you don't have any of those, you're still having problem falling asleep. That's what's called insomnia. Okay. And basically, it's either you have problems falling asleep or staying asleep or waking up too early. Okay, and you got to make sure you have no other medical, psychiatric, lifestyle conditions. So this is why, as a sleep physician, I don't prescribe that many sleep medications for insomnia, because you got to look for everything else first before you give a sleep medication. Okay, because if you're not treating the underlying issue that's causing the sleep problem, it's causing insomnia, then you end up being on that sleep medication forever. So you got to treat the underlying issue first before trying any sleep. Assess for any underlying issue before trying like a sleep medication. Because the sleep medication, such as Ambien or Nulnessus, they should not be used every night. They should be used once in a while, like once or twice, a few times a month or something like that. Because remember earlier I said what happens during sleep. Remember, the brain gets flushed out of all the waste products during sleep, right? That happens during deep sleep, okay? Ambien and all these sleep aids put you to sleep, but actually give you less deep sleep. So you're not getting into natural deep sleep. So that's why people who are in these medications prolonged have a higher risk for dementia, because you're not clearing those waste products. Yeah. That's how it's all connected. Yeah. So now insomnia. So once it starts, it can be self-perpetuating. Say you went through a stressful time in your life. You had a death in the family. You couldn't sleep for a while. Okay, now you're much better. Your anxiety's better. Your stress is better. But now you got into that bad cycle. Now you're in that cycle. You can't get out of that cycle. So you have your thoughts are thinking about, I can't sleep, and that causes anxiety. That causes you to wake up frequently. And now you're tossing and turning and taking sleeping pills, and then it becomes a self-fulfilling prophecy every night. So the more you think about can't sleep, the more you won't be able to sleep. They actually did a study one time where they had two groups of people who couldn't sleep, people with insomnia. One group, they told them to stay awake as much as you can. The other group, they said, try to go to sleep. The people who fell asleep much quicker were the ones they told them to stay awake. Yeah. So again, insomnia, it can be most common cause of stress, anxiety, depression. You got to treat the underlying causes. Another thing we didn't talk about is medications. Some medications can cause insomnia. And some of these are very common medications, such as antidepressants. Some antidepressants should be taken at nighttime, because if you take it during the day, or some of them should not be taken at nighttime, they should be taken during the daytime, or vice versa. If you take it at the wrong time, it can cause sleep problems. Stimulants. Well, caffeine is a stimulant. Don't drink too late. Decongestants, especially if you take some stuff like pseudoephedrine or Sudafed, or if you take it at nighttime, that can cause you to have insomnia in some people. Cardiovascular, some blood pressure medications, such as beta blockers, are known to cause insomnia. So if you have a lot of insomnia, is it a medication-related issue? Okay. Or people use too much what's called albuterol for their asthma. So, and then and we went to circadian rhythm issues. So we were talking before, okay? So the question is it really insomnia that you have? You say, I can't sleep till 2 a.m. every night? Or is it a circadian rhythm issue, meaning, okay, go to sleep at 2 a.m. and just sleep at what time you're waking up. Oh, I'm waking up at 8 a.m. and I feel, at 10 a.m. and I feel great. So that's not insomnia. You can sleep. Just say you're sleeping at the wrong time than what you want to sleep for your needs, So we've got to change your circadian rhythm, okay? Now, if you go to sleep if you can't sleep till 2 a.m. and you wake up at 5 a.m. naturally and you're still tired, that is insomnia, okay? Well, we got to do it slowly. It's behavioral therapy. So let's say your circadian rhythm is 2 a.m. to 10 a.m. And what we do is, you go to sleep, we'll be using melatonin as well, and you go to sleep at 1:45, take melatonin 30 minutes beforehand, and then you set your alarm to wake up at 9:45, and either you get what's called a light box that gives UV light, or if you have access, you go get sunlight. So in other words, you're helping it to go to bed earlier with the melatonin and using a UV light to help your wake hormones wake up earlier. And you're going to change this by 15 minutes every 1 to 2 weeks. Well, the problem is people who go to sleep their natural circadian rhythms at 2 o'clock, but they want to go to sleep at 11, they end up taking Ambien at 10:30. So at that time, your body's treating that as a nap. So go to sleep at 11, fall asleep, and then you wake up at 2 or 3, you know? So in other words, I go to sleep at 11. That's my natural sleep time. Now, if I try to go to sleep at 8 o'clock, I'm not going to be able to fall asleep, you know? If I do fall asleep at 8 o'clock, what happens? I'll wake up at 11 or midnight, and then I won't be able to sleep, you know? Because I just took a long nap, you know? So that's the thing. You got to figure out what your usual time is, and then work from there.
So, taking naps, another good idea.
It's okay. Well, here's the thing about naps. If you're tired, you should nap. But the main thing is, why do you need to nap, and treat the reason why you need to nap? You know what I mean? Okay. Now, what I mean by naps is when to take a nap. Don't take a nap at 8 p.m. Okay. Talk about naps like in the early to mid-afternoon, and it should be short, not 2 to 3 hours. Okay. We're talking about 20 to 30 minutes, just enough to decrease your fatigue. Not enough to put you into deep sleep, because once you get into deep sleep, it's hard to get up. Okay?
So then if you're gonna take a nap, you're gonna set an alarm or something?
Yeah, set an alarm, or if you just wake up, just stay awake, you know? You toss and turn, yeah. Now, so we talked about insomnia, you can't fall asleep. There's something called hypersomnia, okay? Now, any of you heard of something called narcolepsy? Yeah? Okay. So narcolepsy, it's not that common, but I do see it because I'm a sleep doctor. What it is, it's a deficiency in what's called a neurotransmitter, okay? In the brain, there's a lot of these transmitters that keep us awake, keep us asleep, make us like something, make us hate something, you know? So there's a deficiency in one of them that keeps us awake. There's multiple ones that keep us awake, but there's a deficiency in one of them, so people can sleep for 10, 12 hours, always feel sleepy. Now, if it started when you're always sleepy when you're 50, 60, 70 years old, that's not narcolepsy. Narcolepsy starts in the early 20s, between the age of 15 to 25, around that age. So if you're having it when you're older, you got to go through your medications, go through all the sleep other issues, you know? It's that saying. Because narcolepsy is due to a genetic issue with the production of a neurotransmitter. That doesn't happen in your 60s or 70s, you know? And, you know, in movies, you see narcolepsy, people are just talking, and they go, like that. That's all in the movies, okay? Right. Basically, the most common complaint about people with narcolepsy is that, God, I'm tired all the time. I sleep for 8 hours, I sleep for 10 hours, I wake up tired, I can nap anytime I want to, but they still function. They still go to work, they still go to school, they still take care of their family, you know, but they're just tired all the time, you know, and they've gone through many things. They said, you know, went to doctors, said, are you depressed? Or is it Lyme disease? Or they're getting worked up for all these things, you know? In fact, it's not that, it's narcolepsy, and the thing is, it can be treated with medications, okay? Now, and, oh, that's the end of my, so, and I covered very broad range. Do you have more specific questions? Huh?
So why is it when you're extremely tired that you can't fall asleep? That happens to me sometimes. Like I'm doing all these activities and I figure, okay, I should be exhausted.
Mm-hmm.
And then I try to go to sleep and I can't sleep.
What time are you sleeping, and are you thinking about it?
Well, no, I try to go to sleep at 11. That's my
Mm-hmm.
normal time.
Okay.
Sometimes I do a lot of activities here.
Yeah.
Sometimes I feel like as soon as I go down, I should be out.
And then what time are you doing these activities? Are they like right before going to bed, or? Okay, during the daytime. I mean, that's something to discuss. I mean, it could be medication related. It could be like, you know, do you have what's called restless leg syndrome? Do you have other things going on? You know, that's something to get fully evaluated, you know? Does it happen every night or once in a while? You know, breathing problems, if your muscles are exhausted but your brain is still awake, you know, that's a different story. Yeah. Oh, sorry.
So, you know, I'm getting older, I can talk about my own experience. I used to be practically on no medicine until maybe 40 years ago.
Mm-hmm.
Now I am on as many as three
3 aspirin?
different
Oh,
things.
3, uh-huh.
I've elevated cholesterol, I have BPH.
Mm-hmm.
So I need to take a couple of them. But these do damage to my sleeping habit.
Yeah.
I'm convinced.
Yeah.
But I cannot do without them.
Yeah.
So
I mean,
in a quandary as well.
Well, some BPH medications affect sleep more than others. So it depends. You may need to change that. Of the medication you described, it's probably not the cholesterol medication, but the BPH medication. So I would talk to the doctor to change maybe to a different one and see if that, different mechanism, different medication with different mechanism of action. I could see if that can still treat your BPH without affecting your sleep. Hmm? The BPH, yeah. Usually, yeah. But again, it depends on which medication. It depends on which medication. Which one is it? Huh? Labetalol? Labetalol, it may disrupt your sleep. It may. I'm not, we have to go through everything, But that's in the class of medications that may disrupt sleep. Okay, and in that class, it's called a beta blocker. Some of them affect sleep more than others. Because what basically beta blockers, some of them can cross what's called the blood-brain barrier, get into the brain, and that's how it can affect sleep. And other beta blockers do not cross the blood-brain barrier, so they don't affect sleep. Yeah.
You mentioned apnea a couple of times, but what about other sleep drugs like supposedly not apnea?
Yeah.
How about, are there any like negative side effects to taking that long term? When I say long term, I mean like once a week for a couple of years.
Even Ambien once a week for a number of years is not that bad. Okay, any of these medications, I mean,
But then they kind of like say that Trazodone and Hexagon
yeah,
supposedly better than
yeah, exactly.
everyone else.
Yeah, I
So
agree.
there's no detriment to taking it long term.
Yeah,
So you can take it usually.
yeah, it's not as much of a detriment as Ambien. Okay, because it's a different mechanism of action, and the way it affects sleep is a little bit different than the Ambien. Yeah. So, yeah.
How about over-the-counter?
So most of the over-the-counter sleep medications are actually related to Benadryl. Huh? Unisom, yes, Benadryl. If you look at the ingredient, it's Benadryl related. So it's like they're antihistamine related. So they can affect sleep similarly as Ambien. So yeah, once in a while, no problem. But if you need to take it every night, then definitely see a sleep doctor to see what's going on, what other things are going on, so you can treat any underlying issues. So hopefully you're not needing any over-the-counter stuff every night. Melatonin is okay to take every night because that's a natural hormone. But again, the main thing with that is remember you have to take it at the time that your circadian rhythm is putting you to sleep. Okay, remember to figure that out. What time do you go to sleep if you are on nothing? Is it 1 a.m. or 2 a.m., midnight, Whatever it is, take about half hour before that.
Yeah, I just want to testify. I'm on a CPAP.
Uh-huh.
And before I had a CPAP, I lived in New York.
subway,
Mm-hmm.
or at lunchtime, I would take a nap at work, and then in the mid-afternoon, I would get really hungry,
Mm-hmm.
go out for a snack. But with the CPAP, I just feel much better. I don't take any naps anymore. Weird. So I just want to say this is a great thing.
Yeah. How long you been on it?
I don't know, 15 years?
Oh, that's great. Perfect story. Yeah. If you breathe well at night, you can sleep better, and you're not as hungry.
Correct. Yeah, I used to be heavier.
Yeah. Yeah. So that's how. And that's how it's treating a poor sleep. You can treat sleep apnea. It can help with weight loss as well.
I still have some trouble getting to sleep sometimes.
Yeah.
And sometimes I get these crazy dreams that wake me up. And then I can't go, sometimes it's hard to go back to sleep.
Okay.
But I just want to say the CPAP is a good thing.
Yeah. Thank you. Yes.
How many hours sleep do you think? For me, 9 o'clock, I'm out. And I'm up like 3, 4 o'clock. Am I missing anything if I get up that early?
So here's the thing. You read in the in the papers, you read, people need 7 to 8 hours of sleep, right? That's normal. That's for the average person, okay? But not everyone's average. How much sleep you need depends on how you feel.
And I was taking that too.
So here's the thing. If a person sleeps for 6 hours and they still feel tired and they're needing a nap during the daytime, they probably need more sleep. If another person sleeps for 6 hours but they wake up refreshed, they have good energy throughout the day, no problem, then they're a short sleeper. They only need 6 hours of sleep and not the 7 to 8, So it depends on how you listen to your body. If you're still tired at 6 hours of sleep, okay. So that's what it comes down to. So 7 to 8 is what we tell, for the general public, but you got to really listen to your body as well.
I feel like I wake up every 3 hours.
You need an evaluation. Yeah, I can definitely get sleep evaluation. Like if you wake up every 3 hours it's one thing to wake up every 3 hours for like a week or two, but if it's happening for like chronically, yeah, that's when you need evaluation to get like what's called a sleep study.
So, one of the, my wife here worked as a night nurse.
Mm-hmm.
So she was doing with maybe 3, max 4 hours sleep
No, man.
for a long time.
Uh-huh.
And she was functioning okay.
Mm-hmm.
But now it is to a point where she can hardly function. Her balance is gone.
Mm-hmm.
She uses mostly a walker.
Mm-hmm.
And once in a while, not every night, she would tend to have a little wine. She says that helps her. I don't have an opinion. Would you recommend having wine every other day, third day, or would it do harm to her?
Yeah. So having a little bit of wine, if you have no medical problems, okay, is okay. A little bit. I'm not talking about a lot. I mean, it's your definition of what's a little bit. Like, like a half a glass, like a glass or half a glass. Because what can happen is and it also depends on what time you go to sleep. If you're taking the wine with dinner and sleeping 3-4 hours later, that's fine because you've metabolized that wine. But if the wine is still in your system, you have what's called elevated alcohol levels. What happens is, after that wine goes away, then all of a sudden, the way your body reacts, you get more stimulatory. Wine is a depressant, puts you to sleep. Okay, but after it's out of your system, all of a sudden you get reflex stimulation. You actually can wake up more after it's out of your system. So you got to be careful with that, especially if you drink more than a glass or 2 glasses or heavy wine before sleep.
Who would determine who needs sleep study?
How much what?
Who would determine?
Sometimes if your primary care doctor feels comfortable, the primary care doctor, or if not, then a sleep doctor. I'm a sleep. There's a lot of times, since a lot of sleep problems are pulmonary related, so a lot of pulmonary doctors do sleep, do sleep studies as well. So like I work in Bergenfield, my partners work in the Englewood office. There's 3 of them there. They all like do sleep studies.
So how do I get a sleep study?
I forgot my card. Sorry. Kondapaneni.
You know what, I work in England Health and I reach out.
There. Oh, there. Srikant Kondapaneni.
Can I just ask, I'm sorry, maybe I shouldn't ask questions. I don't want to take people's time, but is there anything with age, like when you get older, that you need less sleep, or?
Yeah. Yeah, what happens is as you get older, your body can't stay asleep as much. I mean, you got the 5-month-old, you got a 5-year-old, and a 15-year-old sleep less than a 5-year-old, and a 25-year-old. By the time you're around 20 to 25, you're setting your sleep amount, okay? Are you going to be a 6-hour sleeper? Are you going to be the 8-hour sleeper, okay? But until that age, your sleep slowly declines. And then from about age 20 to around age 50 to 60, around that time, you're going to stay stable. And above that, the amount of sleep you get, or you may have more difficulty maintaining enough sleep. A lot of times it's due to a lot of medical issues. Everything from you're not as active as you used to be in your 30s or 40s. In other words, physically active. Okay, that can affect sleep. Woman, you don't have as much estrogen, so that can affect you when you go into perimenopause. That can affect sleep. It could be a cardiac and pulmonary reason, medication reason. So a lot of things are involved in preventing you from staying asleep as much as you used to when you were younger.
Yeah, so this is my husband. And every morning he wakes up, he has to tell me about his dream. It's like I have to allot time for that. And it's a crazy dream. So it's every morning. So is he getting a decent?
You feel rested, right?
But I have them right before I wake up,
Mm-hmm.
usually.
Do you have an alarm, or you just wake up with an alarm?
No, I don't wake up.
Okay.
But it's that, I guess it's like a twilight.
Yeah.
Between deep sleep and
Yeah.
waking up.
Yeah. So as long as you feel refreshed, not needing to nap, if you're doing okay, then that's not harmful. As long as you're not acting out your dreams. He's not acting out like running or punching or walking in his sleep, then that's okay.
What does sleepwalking mean? What does that mean?
Well, during sleep, actually, it's a condition where you're sleepwalking, okay? And it could be a couple of different reasons. If young people sleepwalking is different than an older person sleepwalking. Like a young person, that could be more psychological oriented, okay? Stress, anxiety, lack of sleep, so in other words, things that preventing that from that person going to deep sleep. So, you're light asleep, you end up sleepwalking. It's easier to sleepwalk when you're in light sleep than in deep sleep. So you really have to see what's going on in that person's life at that time when they're sleepwalking. Older person sleepwalking, it could be more of a neurological issue. That's when you have to evaluate it's a different evaluation for older person.
Slightly off topic, but somebody
Mhm. Yeah. Does that mean when you're like about to fall asleep, you kind of twitch like that? It's got literally the name is called sleep twitch. It's a benign condition. Okay, and just like you hear something, you just and it wakes you up, right? As long as it's not happening every night, it's a benign condition. It's not a pathological. Okay, and sometimes it can be due to again, anything that changes from your usual homeostasis of sleep, it can cause that. And you heard of what's called sleep paralysis? You know what sleep paralysis is? Basically, it's like when you're sleeping and then you wake up, your eyes are open, you're looking around, but your body can't move. Remember I said it during REM sleep, REM sleep, you're dreaming but you have muscle atonia. You can't move your muscles. You can't lift your arms, you know. Well, that's what's happening. Okay, that's sleep paralysis. And if you ever get that, don't be alarmed. It's also a benign condition that's usually caused by a disruption in your usual sleep homeostasis. You know, meaning you're sleep deprived, new medications, you're drinking a lot, you know, something that's disrupting regular sleep.
Does doing heavy physical activity before you go to sleep, does that work against you or does it work for you?
Usually against you.
So you think that if you're so exhausted, you fall asleep?
Yeah, but thing is, you raise your activity hormones, you raise your adrenaline level. Okay, now your adrenaline level has to decrease now. That takes time. You know, that's why we say no exercise for at least 2-3 hours. No exercising right before sleep. You know. All right. Hope you got a good night's sleep now.